guys, I am back for another video, and I'm glad to be doing this. I'm finally doing this video. I've been talking about doing an ABA video for a while now, and I'm going to do it now. I have all important things that I would like to talk about, and things that you guys may want to hear. If not, that's okay, but this is something that I love, and let's just get to it. So first, what a day in ABA looks like. So I do clinic therapy, so it's going to be in a clinic, and basically I come in at 8:30, and I come in at 8:15. My kid gets there at 8:30, pick him up from his parents, and then we get going with our day. So basically what you usually do is you start off the day with their highly reinforced room, item, things like that. So we usually go to the gym, jump around, and usually contrive manding. So manding is them asking to do something, just working on them practicing verbally talking, or vocal approximation. So you'll have them say "buh" for ball, just things like that. So do things like that, and then after that we go back to the room. He usually wants a snack. He likes to eat a lot, so eat a snack, and then by that time it is time for table time. So what table time is you just sit at the table, and you work on specific goals that the kid that is working on and that the BCBA placed into Catalyst for you. And that's just the programming that we use to collect all the data and things like that. So it could be like touch dog, touch something you eat, just anything you can think of. Some other kids are working on hand washing tasks, so working on, tolerating opening, turning on the faucet, getting the soap, drying hands, throwing away, just things like that you're going to have to do outside of therapy. Some kids work on toothbrushing. Some kids work on tolerating a spoon to their mouth, just things like that. So that's what table time usually consists of. You just work at the table, and then they'll work for an item that is highly reinforced. So it could be gummy, it could be a tablet, it could be books, it could be a room, anything like that. And then from there on, whenever you work there for 3 months, you're with the kid at least for 3 months to a year, just depends on situations and things like that. So, usually get a good idea for a schedule that you want to do. I know for me, whenever I first came in, I was really stressed and a lot of nerves on like having things to be exact, and I was always nervous I was messing up. But you're not. Whenever you get going and you know the kid and it works for them, you kind of rearrange what table time is going to look like, still hitting those goals and things like that. But so you do table time, and then there's like group activities. So you have like certain times that you'll go into a room and you sing a song, practice identifying colors, or animals or numbers or shapes, days of the week, what the weather is outside, different things like that. Some therapy clinics will have a kindergarten room where they do a mock kindergarten class, and you work on reading a book and then asking, for example, what did the cat eat, or what did the dog do, things like that. And then you work on crafts, you work on, they have like a movement time where they just like do like, what's the one? Going on a bear hunt, things like that. They work on the alphabet, they work on writing, things that you will see in a kindergarten classroom, which is really amazing. And just throughout the day, you're going to different rooms, and you get to interact with the kid, play around, but you're also working on net targets. So net targets are, something easy for them to do. So like they're in the playroom and we have like a bucket of food, you can have them tell you what it is, point to what it is, but you're still engaging with them and they're not at the table. So that's usually what a day in ABA is like. People have misconceptions that ABA is strictly punishment, and it's not. It's really fun. I have a blast. I definitely have a really, I'm extremely paired with my kids. Pairing is basically like you have a bond with a sister, you have a bond with the dog. The dog is gonna um, respond to you and trust you. Sorry. Trust you and things like that. So that's what pairing is. You're just gaining that relationship and instructional control and things like that. And I've been with my kids for almost a year now, and then one will be like 5 months. So we definitely have a relationship when it comes to therapy. You know, they trust me and they respond to me extremely well. So it's not punishment. I would say 90% of the day they're engaging in things that they enjoy engaging in. So it's like a playground, but they're at school, and we're working on that transitioning, helping them transition into a school environment and things like that. We do have older kids, and the older kids are working on social targets, working on sharing, working on, no, not right now, how to handle difficult situations and how to identify their emotions and things like that, which is really awesome. It's really cool to see how the kids respond and watch them grow for like within a month. So that's what a day in ABA looks like. The whole clinic, aside from the kids, we're a team. And I love my coworkers. I don't go to work dreading situations or dreading the management or the people that I work with. Everyone is really amazing. The management is phenomenal. I really, really like my clinical manager, assistant managers, and things like that. They really, really help keep the clinic together. And they kind of work on the outside of everything. If we need things stocked or a kid needs a reinforcer, they're always there to listen and they help us. And then we have our front desk. Oh my gosh. She takes care of pickup times, drop-off times, handling parent meetings, she makes, the token boards for us, and just things like that. She also helps keep the clinic running when it comes to therapy and helping get us what we need and helping the kids get what they need. And she was an ABA therapist, so she fits the job very, very well. And overall, I love everybody I work with, and I love my day in ABA. So going into that is 2 types of therapy. So it's all going to be ABA, but there's clinic therapy and there's in-home therapy. Sorry, fixing my sock. Okay, so I kind of gave you the rundown of what clinic therapy is going to look like. You're around other kids, you're focused, you're working on identifying colors, blah, 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 all that stuff. In-home therapy, you guys should check out Fathering Autism. They have a Facebook page and a YouTube channel. And obviously there are parents that have a child with autism. And it's amazing to see, watch them grow, and they just put in a video of how she was unloading the dishwasher on her own, and she does in-home therapy. So basically, unloading the dishwasher is helping her identify, the difference between spoons and forks, or bowls and plates, cups and coffee mugs, pans, spatulas, everything that would be unloading in the dishwasher. In the clinic, that would be sorting. So we work on sorting shapes. We're getting kids ready for things like that, helping them identify the difference between different items and different objects. So in-home therapy, you're going to be working one-on-one with that kid, and you're also going to be helping the parents implement things at home that they see that you do with them with the kid at home. So that could be, I've never done in-home therapy. I've mainly done clinic therapy for this first year that I've worked in ABA. But I know a lot of people that have done in-home therapy, and they enjoy it a lot. You gain that relationship with the parents, and you kind of get an idea of, okay, what are they working on at home, and helping the parents teach the kids goals at home. And that's separating from being at home and working at the table. Two completely different things. That's that transition time of helping them apply what they've always learned in therapy to applying it outside in the real world, at home, getting dressed, things like that. So we do all the same things that they probably do in home therapy, but it's two completely different settings. You're doing it at home, like I just said. I'm rambling. And then versus being at the table. So that's kind of the two types of therapies you're gonna see. When it comes to things outside of ABA therapy, it would be like feeding therapy, working on eating and things like that, but we don't do any of that. So going into types of goals we work on, I kind of hit on that whenever talking about what our day in ABA is like. But, type of goals that we usually hit on, like I said, sorting shapes, motor imitation. So motor imitation could, be jumping. Show me jumping. So they go from do this, they're imitating you, and then they go to listener response, it would be show me jumping. So that's showing that they first imitated you jumping, and that's now moving on to, okay, show me jumping. I know what jumping is, so I'm going to jump. Things like that, motor imitation, greeting peers, saying hi, saying bye, let's see, handing someone a pen. So hand Bob a pen. They're going to independently go over to Bob and hand them a pen. Let's see what else. There's just like so many things. So basically, all of our goals are going to have certain names. So it's going to be listener response, function, feature, class. So that's going to be like touch something you eat, sorry, I'm eavesdropping. Okay. Anyways. So yeah, LRFFC, sorting, tolerating, a spoon, open cup. We work a lot on open cup, so drinking from an open cup. A lot of kids come in with closed cups, usually with the sippy cup, and just transitioning from that to drinking from a regular cup. Some kids work on tolerating certain foods, so like, I don't know what it's called, but it's just a tray, and there's different little sections, and you put a Cheez-It, then a chicken. So you would be putting preferred, non-preferred, preferred, non-preferred, and that's helping them try different foods. And we don't push that onto the kids. That is typically when the parents want us to practice that, if they're seeing them struggle with it at home. So a lot of these things are parents' requests. We don't just throw random goals onto the kids. BCBA's talk with the parents, and that's where the parent meetings come into play. So those are different types of goals. I'm trying to think of some other cool ones that we do. Pause, sorry guys. Okay, so let's think of like the older kids. The older kids are really, whenever my kids are out and I have to sub for a different kid, I really enjoy being with older kids because I'm not used to doing some of the things that their therapists do with them, because being with an older kid is completely different than being with a younger kid. So they work on, like I said, social targets. They work on, they play interactive games with other peers, so it could be like tag, hide and seek, really cool things that they would be doing when they transition into school systems. they work on, like one kid before he graduated, they work on going around asking if anyone needs anything, because in the school systems, I don't know about you guys, but whenever I was in high school or middle school, the teacher would always be like, does someone want to volunteer to take this to the front office? So just doing things like that. Some kids practice ordering from a menu. Some kids practice FaceTiming, just daily skills that they're going to be doing outside whenever they make friends and things like that. So that's really awesome to see. I'm trying to think. The other thing I want to hit on is every clinic is different. I know that the clinic that I'm moving to, they do field trips, which is really cool because they're helping those kids generalize outside of the therapy center. So they will go to like the museum, like a kids museum, aquarium. Up north it's snowing, like it snows a lot, so they take them sledding. Things that, they're probably going to do on a daily basis, and just get them ready for that. And also helping them, the parents like to do things with their kids, so just like, honestly, anything you can think of. Anything you can sit down right now and think, could that be a target? It could be a target. Anything. It's not limited to anything. It's really amazing to see all of these targets go into play. I know my little friend that I have, he is so smart, but we were just like, my other friend and her friend, I say friend because obviously I'm not going to say their names. That goes against any ethical guidelines, so I'm being very, very limited whenever I talk about things like this. But, some kids work on acknowledging how old they are. And this is just like a funny moment. We were just like in the room and they were just talking. My friend, the therapist, and her friend, she was asking him, how old are you? And then he would respond. But she asked him that, and then my kid answered, and it was just amazing to see that. We've never worked on his age yet, so it's just amazing. I love it. I think that's like all the notes that I wanted to hit on, because that's something I would want to see. But I think I can't really show you what I wear at work. I just wear scrub pants and then our t-shirt, but I'm not going to show that because my t-shirt would be on it. But I just wear my Brooks running shoes to work, and then my scrub pants. My scrub pants are from, they're Grey's Anatomy scrub pants, and that's usually what we wear. But on Fridays we have theme days. I think it's every payday, so every 2 weeks we have a theme day. And some of the kids usually dress up, which is really, really cool. But yeah, I guess I can hit on like some like other misconceptions that people usually have. Like I mentioned, punishment, and the other one is like we're turning them into robots, and we're not. Every kid is different. I know it may sound like it because we're having them like request for items, so like say you prompt them, so be like, want grape, or I want, go from 2-word mans to saying sentences. And some people might think that whenever they get out of therapy and transitioning into school systems, they're gonna strictly say I want, and I understand it's gonna sound like they're a robot, but they don't. They're gonna eventually transition to just, that's why we do sentences. We're gonna transition from I want tablet to can I play with the tablet, how kids ask for things right now. So no, they don't turn them into a robot. Every single kid there is different. They all have different personalities. They all have things that they fixate on and that they love, which is really, really cool to see. One of the other questions that I got when I posted on my Instagram was, do I give ABA therapy? Yes, obviously. And 2, do I believe in the practices and techniques? Yes, I do. I have not seen anything or don't see anything that I don't think is okay. We handle everything professionally. and we do trainings all the time. We renew our trainings. We have safety care training, so that's practicing how to respond to behaviors and things like that. And then we do like CPR training, blah blah blah. So we are we're certified in all the areas that we should be when it comes to working with kids. We have a large team of responders that in the clinic, like all the therapists, we have teams that respond to assistance calls if we need help with something, and things like that. So BCBAs are extremely helpful. So yes, I do believe in the practices and techniques that we use. All of the therapists that I have seen with their kids are amazing and tremendous with them. And I wish you guys could see, if you guys go into this field and work at a therapy center, you'll know what I'm talking about. But seeing each therapist and their kid, it's really cool to see because they each have their own like relation. Okay, not like this isn't like I don't know what am I trying to say. Like their own bond. They once you are with a kid, you guys know what they're trying to do, what they're thinking. Especially with my kid, he is like the hardest kid to pair with. But now, I'll be like, you can do this, and he'll do it. So they respond to all of their therapists in different ways because they have two therapists if they're all day. So it's just amazing to see each kid's relationship with that therapist when at the clinic. And it just makes me so happy to see all the kids smiling and laughing, running around. We don't take it lightly when it comes to ensuring that these kids are having fun, but also learning and hitting those targets that they need to be hitting. But I think that is it for this video. If you guys want to learn anything else regarding ABA, please let me know. Like I said, I studied psychology, and I've been here for a year now, so I know what I'm doing, and I'm planning on pursuing my master's next year to become a BCBA. So please let me know, because I love this, and I enjoy making videos about this. So one more thing I did want to hit on, aside of ABA therapy in the clinic, we have OT and speech. I forgot to mention on the video, but yes, we do have OT and speech. So the kids are going to different therapies, and they have a scheduled time each day, 2 times a week usually for OT, and 2 times a week for speech as well. And our speech pathologist and okay, so yeah, OT and speech, we have those as well. So the kids are receiving different kinds of therapy with different people as well. So they're not just with 2 people all day. So yeah, I hope you guys enjoyed this video. I enjoyed making it. As you could see, I love talking about it. And I probably have so much more I could have talked about, but that's all I could think of. So please, if you have any questions or ideas, just drop them down in the comments. I will answer them. And if you guys have like thoughts, if you have never seen a therapy center, but you hear a lot about misconceptions and stuff, I would love to hit on misconceptions, because I promise you guys, ABA therapy works. Okay, it works. So go check out Fathering Autism on YouTube and their Facebook page. Amazing family to watch. So if that's it, I will see you guys later. So hugs and kisses.